Next, we're going to talk about digestive processes in the stomach, which include both mechanical breakdown and chemical digestion. Mechanical breakdown in the stomach is aided by the third layer of the muscularis externa, the oblique layer. Having 3 layers of muscle in the stomach make churning and pulverizing food much easier. The denaturation of proteins by hydrochloric acid and enzymatic digestion of proteins by pepsin are examples of chemical digestion in the stomach. The denaturation of proteins unwinds proteins and makes it easier for the enzyme pepsin to break down proteins further. Protein digestion begins in the stomach. Food that is broken down in the stomach is then delivered to the small intestine as chyme. Lipid-soluble alcohol and aspirin can be absorbed into the blood at the stomach, but most absorption of nutrients occurs in the small intestine. However, we do need the stomach for secreting an intrinsic factor, and intrinsic factor is needed for vitamin B12 absorption. Vitamin B12 allows the maturation of red blood cells, and lacking intrinsic factor can lead to pernicious anemia. But we can treat pernicious anemia with vitamin B12 injections. There are neural and hormonal mechanisms for the regulation of gastric secretion. The gastric mucosa can secrete up to 3 liters of gastric juice per day. Vagus nerve stimulation causes an increase in the secretion of gastric juice, whereas sympathetic nervous system stimulation causes a decrease in the secretion of gastric juice. The hormone gastrin largely controls the increase in enzyme and hydrochloric acid secretion in the stomach, and most of the small intestine secretions called enterogastrins are gastrin antagonists, and they are there in order to inhibit acidic chyme and damage to the intestine as that chyme moves from the stomach to the small intestine. There are 3 phases to gastric secretion. The cephalic and gastric phase see increases in gastric acid and other secretion solutions. The cephalic phase occurs as a conditioned reflex that's triggered by just seeing, tasting, or smelling, or even just thinking about food, but specifically foods you like. Whereas the gastric phase occurs and lasts about 3 to 4 hours, and it is stimulated by the food hitting your stomach, causing stretch, raising the pH, therefore interacting with the acidity of the stomach. But gastrin is a major stimulus for the gastric phase and increased gastric acid and other product secretions. Enteroendocrine G cells of the stomach are stimulated by caffeine, peptides, and rising pH, and those characteristics actually then lead to even more gastrin secretion and more gastric acid or juice released. So gastrin is a hormone. Gastrin causes increased enzyme and hydrochloric acid release in the stomach. So during or between meals, there's going to be a low pH in the stomach because of gastrin secretion. But no further gastrin secretion is going to occur between meals because extra acid in the stomach actually inhibits further gastrin secretion. So there's a buffering action of ingested proteins where when proteins are added to the stomach and they cause the pH to rise and no longer be low, we're no longer going to be inhibiting gastrin secretion, and gastrin secretion occurs. 3 chemicals, acetylcholine, histamine, and gastrin, are going to be able to stimulate parietal cells through a second messenger system, and they'll be able to stimulate those parietal cells to produce the maximum amount of hydrochloric acid. Parietal cells are able to pump hydrogen ions and chloride ions into the stomach lumen. When hydrogen ions and chloride ions come together, they form hydrochloric acid. We use a couple of different ion channels and active pumps to get hydrogen and chloride into the lumen so they combine to produce hydrochloric acid. The intestinal phase of gastric secretion has a small stimulatory component where we briefly release intestinal gastrin, but most of the intestinal phase has inhibitory effects where we're going to try to reduce gastric juice secretion. So chyme that is full of hydrogen ions, fats, peptides, and irritating substance will be inhibited or neutralized in the small intestine. These inhibitory effects are called the enterogastric reflex, and the chemicals that are released as a part of this reflex are called the enterogastrones. There are 3 reflexes that act as a part of the enterogastric reflex to inhibit gastric juice secretion. We are going to inhibit vagal nuclei from the brainstem, specifically the medulla. We'll inhibit local reflexes, so we're affecting both local and central nervous system reflexes related to neural control. We're also going to activate sympathetic fibers and make sure that we cause the tightening of the pyloric sphincter due to the activation of the sympathetic fibers, which will inhibit a lot of GI tract activity. This will allow no more food entry to the small intestine at one time, and we'll see that as food moves from the stomach to the small intestine, it does so in 3 millimeter spurts or mounts. So the enterogastric reflex inhibits both short and long reflexes related to neural control of gastric secretion, causing decreased gastric activity and protecting the small intestine from excessive acidity. The enterogastrones are secretin, cholecystokinin, and vasoactive intestinal peptide, and they all inhibit gastric secretion. However, if the small intestine is pushed to accept more chyme, more than that 3 milliliter spurt at a time, this can cause dumping syndrome. Dumping syndrome is common in those who have undergone gastric reduction for weight loss, but it is a nausea and vomiting condition. Here's an overview of the neural and hormonal mechanisms that regulate the release of gastric juice. We can see the stimulatory events on the left and the inhibitory events on the right. So the three phases of regulating gastric juice secretion are the cephalic phase, gastric phase, and intestinal phase. Remember, the intestinal phase only has a short stimulatory effect. Most of the intestinal phase is going to be inhibitory. It's going to use enterogastrins, and it's going to inhibit gastric juice secretion. Whereas the cephalic phase and the gastric phase are going to be mainly stimulatory and will use parasympathetic or vagal nerve stimuli to increase gastric juice secretion. Both the cephalic and gastric phase are able to use neural mechanisms to increase gastric juice secretion. The stomach distension activating stretch receptors as a part of the gastric phase is able to use both long and short reflexes of the stomach in order to cause more enzyme and more hydrochloric acid secretion. And gastrin definitely helps out with that by responding to the food chemicals located in the stomach that cause a rising or raise in pH. Next, we're going to talk about the response of the stomach to filling. It's actually able to keep pressure constant in the stomach until about 1.5 liters of food is ingested. This is because of a reflex-mediated receptive relaxation that is coordinated by swallowing and a center of the brainstem that communicates with the deglutition center and the stomach stretch center. The gastric accommodation is representative of plasticity, or the stress relaxation response of smooth muscle, which is discussed in Chapter 9. Peristaltic waves do move towards the pylorus at a rate of 3 per minute. The peristaltic waves that occur in the gastric area allow for the food to be pummeled against the pylorus. This gastric contractile activity is going to be the strongest at the pylorus, and the basoelectrical rhythm sets kind of an enteric rate of those 3 per minute peristaltic waves. The enteric pacemaker cells in the stomach were formerly the interstitial cells of Cajal. The pacemaker cells are all linked by gap junctions, and these gap junctions allow smooth muscle cells of the muscularis externa to contract in rhythm or as an entity. So we get the entire muscularis contracting as the pacemaker cells use gap junctions to talk to each other. The distension and gastrin increase the force of the contraction, meaning that as more food enters the stomach and as gastrin is secreted due to the chemicals that show up in the stomach and due to chemical digestion, we will see even more gastric contractile activity. It's most vigorous again near the pylorus, and chyme will either go through the pyloric sphincter and be delivered to the small intestine in 3 milliliter spurts, or it will be forced backward as a form of retropulsion. So here we can see propulsion, grinding, and retropulsion in the stomach due to contractile activity that occurs. And the contractile activity is occurring closest to the pylorus. Those peristaltic waves moving from the fundus towards the pylorus, will grind food against the pylorus and the pyloric sphincter. There will be a moment where the pyloric valve slightly opens, and 3 milliliters of chyme will move into the duodenum. But then the pyloric valve will close, and the rest of the material will be retropulsed or pushed backwards into the stomach for further mechanical breakdown. As chyme enters the duodenum, we'll have receptors respond to that stretch. They'll respond to the acidic chemical signals, and this initiates the intestinal phase or the enterogastric reflex. Enterogastrones will be released, they'll inhibit gastric secretion, and they'll prevent overfilling of the duodenum. It's a lot easier to digest carbohydrate-rich chyme than it is fatty chyme. This image shows what happens when there is a presence of fatty, hypertonic, acidic chyme in the duodenum. As the chyme hits the small intestine, so specifically that first part of the small intestine, the duodenum, will use both enteroendocrine cells, chemoreceptors, and stretch receptors as responders. The enteroendocrine cells will secrete enterogastrones, which inhibit the contractile force and rate of stomach emptying. Will then also inhibit via short and long reflexes the parasympathetic nervous system and activate the sympathetic nervous system. Sympathetic nervous system activity inhibits GI tract activity, so it will also decrease contractile force and the rate of stomach emptying. Parasympathetic activity will need to be inhibited because if activated or sending stimuli to the stomach, it would cause an increase in contractile force and the rate of stomach emptying. We want those to decline so that the duodenum has time to digest acidic chyme and neutralize it so it doesn't damage the small intestine. A homeostatic imbalance we want to talk about is vomiting or emesis. So emesis is also vomiting. It is caused by extreme stretching of the small intestine, especially the duodenum, maybe due to intestinal irritants. It could be a lot of hydrogen ions or really acidic chyme. Bacterial toxins, excessive alcohol, spicy foods, and certain drugs can also cause vomiting. Chemical or sensory impulses are conveyed to the emetic center of the medulla oblongata via parasympathetic nervous system fibers. Excessive vomiting is dangerous because it can cause dehydration, it can cause imbalances in electrolytes, and it can disrupt the pH balance of the blood and tissues. It can cause alkalosis. So excessive vomiting is something to be concerned about. It's important to stay hydrated if you are experiencing a lot of emesis, and it's also important to see a doctor if it's excessive to the extent that you start to experience symptoms such as those associated with dehydration. And next we're going to move and look at the small intestine. So next time we'll look at the gross anatomy of the small intestine and its 3 divisions.